Barotrauma, particularly ear barotrauma, is a common issue during air travel, caused by rapid changes in cabin pressure. When pressure changes suddenly, the eustachian tube, which equalizes pressure between the middle ear and the environment, can become blocked or dysfunctional, leading to pain, discomfort, or even damage to the ear. Here's a step-by-step approach to managing this. Step 1. Prevention before the flight. Recommend taking a decongestant like pseudoephedrine about 30 minutes to an hour before takeoff, especially if the individual has a cold, sinus congestion, or allergies. This can help reduce swelling around the eustachian tube, making pressure equalization easier. Step 2. Use of earplugs. Specialized earplugs, like filtered earplugs, can be effective. They slow down the rate of pressure change against the eardrum. These can be inserted before takeoff and before landing to minimize discomfort. Step 3. During ascent and descent. Encourage the patient to perform the Valsalva maneuver, pinching the nose closed, closing the mouth, and gently blowing as if blowing up a balloon. This increases air pressure in the back of the nose and helps open the eustachian tube. An alternative is the Toynbee maneuver, where the patient pinches their nose and swallows. It can be less forceful but equally effective. Step 4. Chewing, yawning, or swallowing. Chewing gum, sucking on hard candy, or simply yawning can stimulate the muscles that open the eustachian tube. Swallowing during ascent and descent is particularly effective in children, who may struggle with the more complex maneuvers. Step 5. Use of warm compresses. Applying a warm compress over the ears during discomfort may help relax muscles and improve blood flow around the eustachian tube. This can alleviate pain and support pressure equalization. Step 6. Pain management. For persistent pain, over-the-counter pain relievers like ibuprofen or acetaminophen can be used. It's important to monitor symptoms closely. If ear pain persists for more than a few hours post-flight, or if there is any hearing loss or fluid discharge, seek medical evaluation to rule out complications like otitis media or a perforated eardrum. Understanding these self-care strategies can help reduce the discomfort of barotrauma during flights, and knowing when to escalate care is crucial for optimal management. Always assess each patient's individual needs, especially those with underlying conditions that might complicate pressure equalization.